Good afternoon, everyone. My name is Clinton Chima, and today I'm going to give a lecture on depression. Depression is a major human disease characterized by feeling of sadness, lack of vitality, insomnia, and inability to enjoy life. In terms of disease and death rankings, depression ranks ninth in terms of disease and death, second only to common disease such as heart disease, stroke, and AIDS. The World Health Organization reports that annually 350 people actually suffer from depression. The World Depression Survey, which was conducted in 17 countries, also found out that in previous experiences, there was an average of 1 in 20 people reported depression. Depression can affect mental, emotional, and physical health. So these statistics and overview actually tell us how serious depression as a disease is, and that it needs serious attention. Now let's look at some of the symptoms of depression. The International Classification of Disease has actually categorized symptoms of depression into three main symptoms. That is low mood, anhedonia, and reduced energy levels. Quite apart from these three major symptoms, there are other symptoms that are also associated with depression, and these include persistent feeling of sadness, emptiness, or hopelessness, loss of interest or pleasure in activities once enjoyed, changes in appetite or weight, sleep disturbances such as insomnia or oversleeping, fatigue or loss of energy. So, when you observe all these things in an individual that you are living with or individuals around you, this actually tells you that there is a symptoms of depression and that person need a serious attention. Now let's talk about some of the risk factors that are also associated with depression. One is medical conditions such as cancer and stroke. So if one is having medical conditions such as cancer and stroke, the probability that the person would get depressed or get depression is high. Also, functional limitation. This is when one is unable to perform or engage in activities that a person actually enjoy most. So, for instance, if I play football and because of my age, I cannot go to the field to play football anymore, that could actually, result in a kind of depression on me because I'm not able to function as expected of me or as I always want it to be. So that can also cause depression. Social isolation and loneliness. When someone is being withdrawn either by the society or by family members, it can cause depression. Also, sleep problems can also cause depression. So, if you look at all these risk factors, these are mostly observed in older adults. Okay, these risk factors are mostly observed or can be observed in older adults. So these actually tell us that the probability that older adults will get depression is high because these risk factors are also associated with aging. Now let's look at prevalence of depression among older adults. So a report from 2022 by NCHS data says that 18.5 of adult age 18 and over experience some level of depression symptoms. Within the 18.5, 11.5 have mild depression, 4.2 had moderate, and 2.8 had severe symptoms. Now, among the older adults, age 65 and above in the US, from 2005 to 2016, a report revealed that an estimated prevalence of depression among older adults was 16.22%. Within the 16.22%, 13.0 was mild depression, 2.71 moderate depression, and 0.42 severe depression. Now, a study was also conducted to compare depression among older adults living in community and those living in home healthcare, and it revealed that those who had or who were living in community, depression among them was only 5%, and also those who were living in home healthcare was 11.5%. In terms of diagnosis, medical conditions such as stroke or heart disease are or can cause symptoms, and we normally confuse these symptoms with depression. In terms of manifestation, frailty, inevitable result of life changes, chronic illness, and disabilities are also some of the things that manifest to tell us that there is some kind of depression or depressive symptoms. In terms of treatment, medication and psychotherapy has been proven as the best option for treating depression. However, the combination of both have been also been productive in terms of dealing with depression. Thank you.